Hey, thanks for coming back. This is going to be the second video of the cancer drugs. My name is Nurse Nick. I'm an emergency department nurse, American Heart Association, ACLS, and PALS instructor, and a pharmacology instructor at the college. So this is the second video where we're going to be talking about cancer drugs, chemo drugs, and I'm going to go right back in. We last left off on leuprolide. This is doxorubicin. So doxorubicin is going to treat solid tumors. All right, so doxorubicin treats solid tumors. It binds the DNA, inhibits DNA and RNA synthesis, and it causes death of rapidly replicating cells. So again, the ones that cause death of rapidly replicating cells, chemo drugs don't target one specific area or not. It's going to kill other rapidly replicating cells. So you might have the risk for stomatitis. What I say stomatitis was? It's going to look like those canker sores inside of your mouth, or also mucositis, right? But this can also cause GI upset, bone marrow suppression. It's common with all these chemo drugs, bone marrow suppression. We should look at our CBC levels, complete blood count levels. Whites are what? 5 to 10. Your hemoglobin, I want you just to remember between two numbers, 12 and 18, okay? Hematocrit, 45%. I was actually talking to a pretty intelligent guy. He was telling me that one way to remember is your hematocrit actually might be 3 times the rate of your hemoglobin. It kind of makes sense. So if it's 12 to 18 for women, hematocrit could be 37 to 45%. So even at the lower side, 12 times 3, 36, or even the higher side, 36, 46 plus 8 is 54. You're going to always be in that range with the percentage. But recognize what's the most important numbers with your H&H, your hemoglobin and hematocrit. Your hemoglobin is the biggest indicator of blood loss. Generally, based on different policies or whatever establishment or healthcare area you work for, usually you don't get blood until you're less than 7 or less than 8 hemoglobin. All right. What is the hematocrit? Hematocrit is the percentage of red blood cells in your body. And then remember your platelets. Your platelets are 150,000 to 400,000. Platelets are responsible for clotting. So doxorubicin treats solid tumors, works on DNA and RNA synthesis. But doxorubicin can cause red discoloration or of your urine, sweat, and tears. You should educate your patient that. That would probably freak me out if I had this and I went home and I was sweating red or crying red. It'd make you nervous, right? So educate your patient on that, monitor your CBC, and I remember that it makes things red, so doxorubicin, rubies are red. Doxorubicin can make things red. But while we're talking about things that make secretions red, there's a couple other drugs I want to talk about. There's an antibiotic given for TB. It's your rifampin. Remember rifampin. If we're talking about TB, there's 4 drugs. Rifampin makes your secretions orange or red, and then also ethambutol starts with an E, messes with your eyes. Now we're talking about things that make things orange or red. Some people remember azo. That's what it's bought over the counter as. But phenylazoparidine is Pyridium. This is given as an analgesic for UTIs, and this makes your urine orange. It's an expected thing as well. So while you're trying to mesh things together, because it's time for the NCLEX and trying to think thought processes for everything, doxorubicin, cancer drug, make things orange and red. Rifampin also, and then azo or phenylazoparidine, which is Pyridium, makes things orange or red. So the next medication is going to be vincristine or Oncovin. And this medication is unique. This is going to be an antimitotic medication for cancer. It treats a variety of tumors. This one stops cell division, and it does not cause bone marrow suppression. Vincristine does not cause bone marrow suppression. But this medication does have adverse effects that includes peripheral neuropathy, phlebitis, GI upset, alopecia. Alopecia is pretty common with all the chemo drugs, right? And then also give antiemetics, monitor for neuropathy, and you want to make sure you use a central line with these cancer drugs as well, right? So the next medication is going to be cyclophosphamide or Cytoxan. So this treats a variety of tumors, but this one definitely has its own unique adverse effect. It does cause the bone marrow suppression. Watch out for leukopenia, thrombocytopenia, and also you might see agranulocytosis. So let's address that for 1 second. Leukopenia, low leukocytes, right? Or thrombocytopenia, low thrombocytes or platelets. Why is agranulocytosis low white blood cells? Well, because it starts with an A. It's almost like a double negative. Without granulocytosis, without white blood cell growth. So agranulocytosis, low white blood cells. So with this medication, cyclophosphamide, also known as Cytoxan, this medication, you want to increase fluid intake, monitor urine for blood because this can cause hemorrhagic cystitis. When you hear cysts, what do you think of? You should be thinking of the organ that is your bladder. Right? Cystitis is inflammation of your bladder. Cystoscope is a scope of your bladder. Right? Think about other organs like your liver, hepatic, kidneys, nephro, gallbladder, chole. Always remember those things. Cyclophosphamide, Cytoxan. Look out for hemorrhagic cystitis. You might even see hematuria, blood in your urine. And the last medication I want to go over, we went over this with GI. This is going to be ondansetron because it's commonly given. It's commonly given with cancer drugs or oncology drugs. So Zofran has a common adverse effect, which is going to be a headache and can cause dizziness. But also it does have a riskier one with widened QT intervals, and that might lead to a dysrhythmia. And make sure you proactively or preventatively administer ondansetron or the antiemetic before you give chemo or anything that you know that's going to cause nausea. So I'm Nurse Nick. Thanks for hanging out. We're going to have one long sequence of cancer drugs or chemo drugs. Stick with me. Come back. Thank you, guys.